Good afternoon, everyone. Thanks for joining us for Town Hall number 6, our town hall about condom legislation in schools. And my name is Becca McCrae. I'm the VSSNA president, and I'm happy to see you all here today. I do have a few announcements to begin with. We do have a board meeting this Saturday. It will start at 9 a.m. and it will be a Zoom meeting only. There will not be an in-person component. If you're interested in joining our board meeting, please email covid-19@vssna.org and we'll make sure that you get a link to the Zoom meeting. We will also send the link to our current active members list of emails. Going forward, when we have an important email to send to school nurses, we will only be using the members list of emails. This is not the same list that we used for the town hall invites. That list will stay the same for town hall invites, but when we write an email to school nurses directly about what we have been involved in at the state level, it will now only go to our active members list. So please make sure that your membership is up to date if you would like to receive these emails of important updates. I'm proud to announce to you that we will have a school nurse advisory group that will represent school nurses in Vermont, both geographically, in grade levels, as well as private and public school settings. And we will be meeting with the AOE and Secretary French bi-monthly to discuss how school nurses are doing and what is happening on the ground with COVID and all of the different initiatives the state has us working with. All right, well, we are excited to have Andrea Nicoletta here to present to us today on the legislations around condoms in schools. And she is the Education Programs Manager at Planned Parenthood Northern New England. She's the only educator. She's been a sex educator for the last 15 years, and before that, she was a French teacher in high school level. So she loves school nurses, and we are so happy to have her here. Please stay muted while she is speaking and presenting her material, and put any questions you have in the chat box, and we're going to address those hopefully as we have time today. Andrea has let us know that she is very skilled since starting all these trainings through COVID at reading the chat and addressing the questions in her presentation. So without further ado, thank you, Andrea, and the floor is yours.
Thanks so much, Becca. Hi, everybody. Andrea Nicoletta, she, her pronouns. I do have some slides that I'm going to start sharing, but first I just wanted to say welcome. Thank you all for taking some time with me this afternoon to hear about condom legislation. And with that, I'm going to go ahead and share my screen, and we will get started. All right. I'm gonna assume you all are seeing it. Let me know if that is not the case. So before I jump into this work, I just really want to be sure and recognize that Planned Parenthood of Northern New England is not alone in it. We are incredibly grateful to have partnered with the Vermont Agency of Education and the Vermont Department of Health for years on helping young people access sexual health education and sexual health services, including condoms at school and at community locations. And so I just really want to recognize that while I'm here speaking with you today, this work would not have happened without both of the Department of Health and the Agency of Education's amazing work over the years, which we'll talk a little bit about. I'll also point out the bit link here at the bottom of this slide, bit.ly/CAP-Vermont, is a whole resource folder of resources that we'll talk a little bit about for you today, and you can revisit after this presentation at any point. It is case sensitive. So just keep that in mind as well. So the first thing I want to say to all of you is thank you so much for everything you have been doing. Like in a normal year, I'm grateful for school nurses. And in the last, I've lost track of how many months we are at. Like, you all are incredible and you're doing so much to keep young people safe. And I am just deeply appreciative and want to say thank you from changing course from all of your wonderful, important COVID work to now talk about condoms with me. So thank you. I want to talk a little bit about the road to 16 VSA 132, which is the statute number for this condom availability legislation, sort of a how we got here. The first sort of step in the process happened in the 90s when condom availability programs in schools began in response to the AIDS epidemic. So there was often one person in a school who was like, we've got to make condoms available because young people need them. I call that person the condom champion. So those folks would often like put a bowl out or have a secret drawer or do something to ensure that young people could have what they needed for safer sex. That's like the first sort of flag. And this is very recent history. There's probably much longer history, but we're not going to go any further back than the 90s. If we skip ahead to the 2010s, in the beginning, sort of the 2012-ish timeframe, the Vermont Agency of Education had a federal grant we called VSHEP here, the Vermont Sexual Health Education Program, that granted specific SUs or SDs. I think there were somewhere between like 13 and 18, depending on when it was, 13 to 15 schools that were tasked with improving adolescent sexual health. And one of the goals that the Agency of Education had at that point was to increase the number of schools with condom availability programs. So they started that goal and that work. PPN&E came to the work around the same time. And what happened for us is our high school peer educator program began in January of 2013. And our first cohort of students said, why aren't there condoms in our school? Can we work on that and make that happen? And I said, sure, let's try it. And that was in January of 2013. So PPN&E started talking to schools about condom availability programs, and then we're brought into this VSHEP grant right around the same time. And so that was really kind of where I feel like this current road began. AOE and VDH issued a joint memo in 2016 that was really, I think, a watershed moment. When they wrote this memo that said, like, schools are an appropriate place for condom availability programs to help young people with their sexual health. That was really the moment that a lot of folks started to think about becoming a condom access point or implementing a condom availability program. And it took that memo for the school where the first group of peer educators in 2013 were to actually get it to happen at their school. So it took almost 5 years from the point that our students said, we should have condoms in schools, to the point where that particular school that we started the conversation with actually did that. And this memo is a big part of why. And then in the 2020s, many things happened very quickly as we are in October of 2021. And now I have like a bunch of different things that have happened. So in January of 2020, the AOE and VDH re-released that memo and not only reiterated support for condom availability programs, but they also talked about comprehensive health education and how important that was. In the same month, a bill requiring condom availability in schools was proposed in the Vermont legislature in response to testimony about something else. And then in October of 2020, Governor Phil Scott signed the bill, and that went into effect July 1st of 2021. So in just, 24 months, 22 months, we went from, gosh, it would be great if condoms were available in schools, to schools have to provide condoms. And that's really an amazing, I think, accomplishment. So let's take a look at the text of the law. This is a lot of text. I'll read it very quickly, but I don't feel like you have to have it memorized. In order to prevent or reduce unintended pregnancies and sexually transmitted diseases, each school district shall make condoms available to all students in its secondary schools free of charge. School district administrative teams, in consultation with school district nursing staff, shall determine the best manner in which to make condoms available to students. At a minimum, condoms should be placed in locations that are safe and readily accessible to students, including the school nurse's office. So I want to recognize that school nurses' role is front and center in this law. Y'all are the folks who are figuring out how to make condoms available in your schools, and you are the location that is one of the access points for your students. So really specifically says that like this is a program that school nurses will have a lot of involvement with. One question that has come up about the law often is that it says all students in its secondary schools. The Agency of Education just this week issued some guidance around this, and this is one of the points that they were really great about clarifying. A secondary school is one that serves students who are somewhere in any of the grades 7 through 12. So this includes our high schools that serve grades 9 through 12, but it would also include a middle school that has 7th and 8th graders, or a K to 8 school that has 7th and 8th graders. So if there are 7th and 8th graders in a building, they need to have access to condoms based on this law. So that's one thing I just like to clarify. Other than that, like this is pretty general. So I want to talk a little bit about what that'll look like, or what that could look like for you all. First, we have this rationale, and my slide just skipped a little far ahead, so it'll just, there we go, caught up. Sorry about that. The rationale here comes from the Agency of Education's guidance document, and it's linked, that document is linked in a later slide. PPNE and the Vermont Department of Health collaborated with the Agency of Education on the creation of this document, their guidance document, and it will inform some of what we discuss here as well. So I just want to point out that the rationale for condom availability in schools is that there are sexually active students in our schools. We know that according to the Vermont Youth Risk Behavior Survey. It's about 40% overall. Some schools might be a little higher, some might be a little lower. In 9th grade, the percentage is lower. 12th grade, the percentage is higher. So this will be useful for some percentage of schools. These numbers are also pretty in line with the rest of the country. But the point is that in our secondary schools, there are students who would benefit from having a place and a way to access condoms. We also know from that same youth risk behavior survey that condom use rates are around 50% for students who identified as female and 59% for students who identified as male, which does leave a pretty large percentage unprotected. So these folks did not use condoms and may be at risk. They may have used other birth control methods to prevent pregnancy in some of these cases, in many of these cases, but condoms specifically for preventing STIs were not used by a large percentage. And we know that STI infection rates for young people are very high. They are a very, very overly represented in STI diagnoses. Despite not being a majority of the sexually active population, they are a majority of STI infections. In Vermont, 70% of the chlamydia infections in our state are in the 15 to 24-year-old category. And condoms are a way that can be prevented. We also know that in Vermont, minors have a right to access a full range of sexual and reproductive healthcare services without parent permission. So condoms are an over-the-counter product. Any person of any age can walk into any store and buy them off the shelves without showing an ID. So parent consent is not needed for condoms generally. And that is also true of many of the sexual health care services that young people might access. So the rationale is, if young people can go to a store and buy them, shouldn't they be able to get them in settings that are familiar for them as well? What the research tells us about condom availability programs is also something we often hear questions about. This first one says condom distribution programs. I just want to note the CDC will use distribution in their language, but we found availability is actually a little bit better, because when you say like it's a condom distribution program, people picture you're like throwing condoms at people and like placing them in the hands of people who don't want them. You're distributing, when the reality is you're making them available and the folks who want them are taking them and the folks who don't are not. So you'll see both sets of language and stuff from the CDC. They found that these programs increase condom use, increase people carrying condoms, promote abstinence or delay sexual initiation, and reduce STI rates. So these programs are effective. We find that their results of a significant increase in condom use among sexually active students does not also lead to an increase in sexual activity. So students who were not sexually active did not suddenly become sexually active just because they had access to condoms at schools. So it doesn't change the sexual activity level. It merely ensures that the sexual activity that is happening is protected. We know that sexual health education programs, the things that are happening in health classes, when they're comprehensive, they are working. So the things that are happening in the health classes in your secondary schools, in your middle schools, in your high schools, those are resulting in a delay in first sexual intercourse, a decrease in the number of sex partners, and an increase in condom or contraceptive usage. So these things can pair together to ensure that young people are healthy. We also know that if you require teenagers to tell a parent before they can access contraceptive services, they don't choose to not engage in sexual activity. They just have unprotected sex. Many young people might choose to tell their parents and have a conversation about it, or maybe they've already had these communications with their parents about sexual activity and values. But for the ones who do not feel like they can, requiring them to tell a parent does not actually get them to communicate or get them to make safer sex choices. It just says that like they can't access contraceptive services, unfortunately. We also know that young people who use a condom the first time they have sex are 36% more likely to continue using condoms than those who don't. So if we can ensure that the first time a young person chooses to be sexually active with a partner, that they have access to condoms and can use them, we can impact their future sexual choices and protections that they might use. So these are all sort of additional reasons why condom availability in schools can make a lot of sense. I'll pause and see if any questions come up in the chat before we transition to what does this actually look like? So let's talk about some best practices for condom availability. If you didn't get your question typed in time, feel free to keep typing it and I'll keep an eye on the chat there. This list of best practices is informed by years of working with schools to implement condom availability programs, from working with the Agency of Education and the Department of Health, from public health and CDC research. All of those kind of went into what we're thinking of as these best practices. I want to be clear that these are not required in the law. Most of the time, there are a couple that make a mention, but they're not required by law, but they will make sure that your condom availability program is as effective as it can be, or as effective as you can make it. There are 7, and we'll go into them in a bit more depth in the following slides. As I talk about them, I want to say right here from the jump that I'm going to identify some common mispractices that I've seen. And I don't want anyone to feel called out if your school is currently doing one of these mispractices. I know we are all coming from a place of wanting young people to be safe and healthy. And so I just want to talk through some of the things that I've seen and maybe why folks would consider doing something a little bit differently. But I don't want anybody to think like, oh, this means our condom availability program is terrible. That's not what I'm saying. We just know that there are some things that we can do to make sure it's as supportive for young people as it can be. So the first one here is write a policy, procedure, protocol, and give it a designated home. So policies are usually a school board level or require school board approval, and typically would govern maybe the whole SU or the whole SD. A procedure or a protocol usually just requires admin approval. I'm going to use procedure here, but I'm talking about any of the 3. Some folks might have a policy or a procedure for the SU level, the supervisory or the school district level, and then a procedure for each school. Some folks might just have a procedure for the school. Whatever it is, I encourage you to actually put it in writing. And here's why. Remember how I said condom availability programs started in the 90s and there was a condom champion who did it on their own? What we find happens is the minute that condom champion switches schools, retires, moves into a different position, an entire group of young people loses access. That program goes away because that champion went away. When you have a written procedure, though, everyone knows whose role it is and how it's going to look. We're not subject to the same changes that staff changes would bring. It also gives us the ability to ensure everybody is on the same page about how it's going to work. Some additional benefits here is that thinking about, if health teachers are an access point and guidance counselors are an access point, it ensures that the experience for young people is relatively similar in both places. So the other part I like to point out is giving your policy or procedure or protocol a designated home so that you know where to find it when you're asked for it. I recently asked a school for an updated copy of their protocol or procedure because they had provided me with a link to it, and I was just checking on something and I clicked on the link and the link was broken, and I said, can you just send me the updated link for where your policy was? And no one at the school could find it. No one knew where it was. And imagine if I'd been a parent or a school board member, that might have been a really frustrating conversation for everyone. So are there nursing protocols that you can put it with? Can you add it to the student handbook? Is there a procedure binder? Is there a section of your website and then you save it in a specific person's files? There are lots of opportunities and places that you could do that. I also really like to reiterate, that sorry, just getting distracted by the chat. I will make sure that it gets into there before the end, folks. But bit.ly/cap Vermont. I just can't paste from a slide at the same time. So just to ensure that it's stored in a place and that folks know where it is, you can easily, hopefully, find a spot that makes sense for you and communicate that with everybody else who would be impacted by that policy or procedure. The next thing that is a best practice is to make condoms widely and easily accessible. And what we mean by that is that young people don't have to do anything special to get them, and they're in maybe more than one location. So the law says condoms shall be placed in locations that are safe and readily accessible to students. And so these are some of the ways that you can do that. Think about who are the school staff who could make condoms available. It's nurses are in the law, but could it also be guidance counselors, athletic trainers, the health teacher, a phys ed teacher? Is there more than one person who might be an access point? We try very hard not to put up additional barriers. So we don't make young people pass a quiz about how to use condoms before we give them condoms. We don't make them have a conversation with an adult or review a brochure or do anything like go to an out of the way location and, at an inconvenient time. We try to make it really easy. Some young people will be able to clear any barrier you put in front of them, like the white dog that jumps over this hedge, right? Like, woo, can do that totally fine. Others are going to end up like the brown dog, and the barrier is just too high for them. And still others may not even attempt it if it doesn't feel easily accessible. So just really important to be thinking about as low a barrier as possible, like make it very easy, because when we make condoms difficult to access, we also perpetuate stigma and imply that somebody has to earn the right to carry a condom, or they have to, they're doing something wrong by wanting to access a condom. So we want to just make really sure that people can get to the access points and can get what they need to take care of their health. We know that not having condoms doesn't prevent somebody from having sex. It just means that any sex that they choose to have will likely be unprotected. One quick word here is there are some mixed reviews on bathrooms. If it's like in the public restrooms of the school, that can be a place for mischief, even though it's kind of a discreet place. And condoms flushed down a toilet can cause a real headache for everybody. So, some folks have had success with it. Maybe if there's a bathroom in the nurse's office or some other kind of location where that ability to cause mischief maybe isn't as great. But you all probably know your schools. And if you are wondering about other places, right, talk to students. Where would they be comfortable? We have one school that has chosen to put a bowl of condoms in the health section of the library. So in that health resources section, there's just a bowl of condoms there available for students who maybe are, researching something else related to health. Keep condom availability provision simple. It's, a condoms in a bowl, condoms in a drawer. Don't go, the harder you make it on yourselves, the more time it's going to take. Some schools have thought about making little goodie bags where they put a certain number of condoms and literature and lube all into a baggie, and then students can take that. But those folks often end up spending a lot of time assembling those goodie bags, right? Like you assembly line, here's the 3 condoms, here's the lube, here's the literature, and that takes time. So saving yourself the trouble is okay. Put the literature nearby, but don't make it too difficult. So hit that easy button when you can hit that easy button. We want to encourage you to include safer sex materials and information that are inclusive of students of all sexual orientations and gender identities. The intent of the law is to prevent pregnancy and STIs. And what we know is that condoms don't appropriately do this for everyone. So things like oral dams are important for students who are not having the kinds of sex that an external condom would work for. Oral dams or dental dams are a square piece of latex that can be used for safe oral sex on a vulva or an anus. And while it's possible to cut a condom so it acts as a dam, dams can be a little bit more convenient and easier to use. So if you're able to, providing a variety of those is preferable. We want to think about inclusivity in our handouts too. A lot of condom literature still uses some outdated language like male condoms. And what we know is that people don't have to be male to use condoms. So ensuring that your language actually supports all sexual orientations and gender identities can be really helpful. And PPNNE can offer some resources and suggestions if you don't have those available. I also want to encourage folks to think about things like lubricant. It reduces condom breakage, and we know that condom breakage is a problem. So thinking about, ways that we can help young people be effective condom users so that they don't end up with a broken condom also is really supportive of health. I do see somebody in the chat who is talking exactly about the bathroom issue, right? That sometimes away from folks' eyes, people are like, oh, this would make a great water balloon. And I will talk a little bit about a related issue with that. Some play with condoms in non-sexual situations can be a really great learning experience, but water balloons in the bathroom is not something that anyone should want or have to deal with at a school. Most students are probably not going to ask questions when they get their condoms, but it is also important for staff to be trained to respond to other sexual health inquiries if students bring them up. I also see in the chat, latex-free condoms should be available. Yes, folks can make latex-free condoms available as well. That will be a slightly different. We'll talk a little bit about ways to obtain those at the end because they are significantly more expensive than condoms that contain latex. So just a little note there, but yes, for folks who have a latex allergy, latex-free condoms are vital. So staff should be trained in some sort of way. This would be a great opportunity to partner with the health teacher in your SU and SD to just make sure that folks have some basic information. And this might be another opportunity where PPNNE can help partner. We have not exactly a condom access point training, but we do have a resource finder training that has information and resources about a variety of sexual health questions. We want to also make sure that the adults who have those condom bowls know what I call some basic condom sense. So they need to know that, leaving condoms in the sun on a windowsill is not a good idea. Another mispractice that I've seen is folks have a condom bowl, but they're in a hurry, so they throw a bunch of pens, and in one case, a bunch of pins into the bowl with the condoms. That's not a great idea. Sharp things can puncture condoms and render them very ineffective. So we want to just make sure that those adults also have a little bit of information and condom sense. We also want to really let students take the lead here. We don't want adults who are providing condoms to make jokes or to stigmatize young people who are taking the condoms. So just another really important thing to kind of do some basic information with. And like I said, this might be a great thing to connect with your health teacher in the building about. They might be able to sort of help with that, come up with a one-pager or connect with PPNNE, and we may be able to help you as well. Inform people about your condom availability program. How are you going to let students know? Are you going to let parents know? You can put a line in a newsletter or on your website. You can link parent-child communication resources that you vetted for accuracy and reliability to help support parents in discussing sexual health with their young people. The law does not provide a parent opt-out. The law specifically says that schools will make this available to all students. So parents get to communicate their values with their children and discourage them from taking condoms, but parents do not have the right, based on the law that our legislature put into place in this state, to say, do not give my child condoms at school. Which is helpful. Now you don't have to worry about an opt-in or an opt-out or checking a list to make sure a student is on it. They're just there. PPN&E in the folder that we've linked to has some condom availability program talking points and a fact sheet that can help you communicate with parents in the community about your condom availability program. We can also, if your health teacher doesn't already have like parent resources that they might use when they're doing sexual health education in health classes, there are also some great parent resources that can be provided either by your health teacher, by us, by the Planned Parenthood website, lots of things there. And this is the last one here in the best practices: to understand the litter issue. Students will likely play an experiment with condoms in the beginning. Generally, it's pretty short-lived. Like the first week or two is like everybody's taking condoms and opening them up and putting them on their hands. And then it just becomes normal. So while it's frustrating to clean up condoms, just like it's frustrating to clean up after lunch, masks that people drop in the hallways, right? It's important to remember play is one of the ways we learn about things. Like I would much rather have students' first interaction with a condom be opening it up and putting it on their hand than when they are opening it up and depending on it to prevent pregnancy and STIs. Question about latex. If we have a latex allergy in our school, is it possible for us to only provide latex-free condoms? If your school chooses to, you may purchase only latex-free condoms. Latex-free condoms are significantly more expensive than latex condoms, and PPN&E is not able to provide those to schools in large quantities. So again, I think it is, you'll know the severity of a latex allergy in your school. Is it somebody who can't even be in a room with latex that has been opened? Or is it somebody who just can't touch latex? And that might be an important conversation with that individual and kind of with other people, or if you notice this condom litter issue happening. Yep. So what happens next? I made a little flow chart for you because I saw a previous talk and was like, oh, there's some flow chart discussion. So let me make you a little condom flow chart. This first step is the same if you are in one of two situations. Your SU, your SD, your school does not have a written procedure and doesn't provide condoms, or you don't have a written procedure and you do provide condoms. What I would encourage you to think about for your next step is consider adopting a written procedure. If you decide to do that, write and adopt a condom procedure and then implement condom availability. It's a very simple flowchart. If you will not consider adopting a written policy or procedure, just implement condom availability. Easy. If you already have a written policy or procedure, review your policy. Make sure it meets the law and the best practices. If it does, excellent. Keep implementing condom availability. If it does not, make changes to bring your procedure in line with the law and the best practices and implement condom availability. All roads lead to implement condom availability. It is a state law. So there are the things that you can do. Here is the available support. This Google Drive clearinghouse for condom availability resources that we've linked a couple of times in the chat has a link to the Agency of Education guidance that was posted on Tuesday called Recommendations for Supervisory Unions, Districts, and Schools from the Vermont Agency of Education. So there's a link to it in that. It is hot off the presses, brand new. Additionally, in this folder are the fact sheets that I talked about, and there are editable templates. The Agency of Education's guidance has a a SUSD level policy and procedure or procedure template and a school level procedure template. The Google Drive folder has editable copies of both. All you have to do if you would like to adopt a condom availability procedure is make a copy and fill in the name of your school. You can do more if you want to change it further, but all you have to do is in the brackets where it says school name, you write your school name, and then it's done. If you choose to put any kind of procedure in writing, PP&E will provide you with free condoms, dams, lube, and literature this year. We are able to do that. I hope we'll be able to keep doing that, but you have to have a written procedure to get free condoms from us. We're mailing them right now due to COVID, unless you're in Chittenden County and we can drop them off. We do ask that only one person requests condoms from us for your whole supervisory union if possible. And there's a Google form available for that, that all you have to do to get it is send me an email, and my email is also linked in the folder. If you choose not to write a policy or procedure, that is okay. You do not have to do that according to the law. You're eligible for what we call nonprofit or school pricing from condom suppliers. So don't think you'll be paying retail price for condoms, because condoms are in a bulk pricing or like $75 for 1,000 of them. So they're much more affordable purchased that way. And then, as I also said, we have a youth sexual health services resource and referral guide with an associated training. And if you'd like to get more training on that, we can absolutely set up a time to do that for you and or for any other adults in the building who are those condom access points. Couple more resources about supporting sexual health education. So there's a published document called the Essential Topics in Sexual Health Education that talks about sort of the bare minimum if you're teaching sexual health education in schools, like what to include or what to prioritize, with an associated webinar series. And then there's also one about inclusive sex education. I know that your world is less this, but some of you may be pulled in to teach these topics. And so I did just want to make you aware of them. And again, they're linked in the Google Drive folder. These slides are there. You can just click to get more information. And with that, I will pause for questions and stop sharing briefly and then go back to it for closing. What questions do you all have based on all of the information I just said a whole bunch in the last 45 minutes? Can type them into the chat. We do also have some time. If anybody would like to speak, you can raise your hand, and I think our tech people will be able to help you with that. Is there a template for a jumping off point to write a procedure? Yes. So there is one in the Agency of Education's guidance, which is a PDF. So there is a SUSD level procedure. And then there is a school level procedure template. There's an A and a B in the Agency of Education guidance. They're both PDFs. And so what we've done in our condom availability folder is we've made them Google Docs for you. So you can just make a copy and then you can edit it to apply it directly to your school. So the template is there. It's the same whether it's in the PDF or whether it is available in the other. I see where to obtain. I see a question about, does the law apply to Catholic/private schools? I am not the agency of education. So my understanding from them is that I don't know if private schools are different than Catholic schools, but this is the law specifically for public education. So I believe that it is does not apply to Catholic/private schools. What I will say for maybe for not the folks who are ideologically opposed, but if you are a private school, I think you may want to consider the equity in making sure that your students at your school have an equitable experience to students in public schools. So if you are at a private school where it isn't necessarily a values clash to provide them, but maybe it is just like well, we're not required by the law, my argument would be, wouldn't you want your students to get the same kind of experience or a similar kind of experience to those in public schools? Like, would you like your students to be put at greater health risks? That doesn't seem like the goal of many of us for our young people. We want them to be safe and healthy. And if access to condoms is what they need to do that, like that would be great for folks to implement. So that's, the law has one thing, but philosophically, folks might have different beliefs. And if your private school does not provide condoms, is there a way that you can still ensure that there are access points in the community, right? If there's a private school that isn't maybe ideologically opposed and doesn't want to adopt condom availability for some other reason, are there places in the community where young people could go and get condoms that you could make them aware of? There's a question about where to obtain condoms. Again, that bit link folder is the place to go. If you can't copy it, I think it will be posted on the VSSNA page with the resources from this. But if you type in bit.ly/cap, that CAP has to be capitalized, and then Vermont needs to be all in lowercase, you should be able to get it. If not, you can also email me. I'm going to put my email. Hopefully I'm going to spell it right in the chat. And I'm going to give you my simple email, not the one where you have to know how to spell my last name. It is education@ppnne.org, and I can email you the direct link to that as well. Other questions about condom availability, questions about how you can implement the law, questions about PPNNE and our programs, or anything else?
Andrea, I'm wondering how often people have to resupply their condoms. I know that's probably based on how many people take them, but on an average, if we're doing this as a school district, how often are we going to be contacting your office to say, hey, I need another supply? Is it once a year, twice a year, 4 times a year?
That's a great question, Becca. And I would say it sort of varies. What I found, so I've been supporting schools since, I feel like not the first school, because we've got some schools in Vermont that have been doing this since the early 90s. Causing just, there's a little bit of background noise for me, hopefully. What I would say as far as number is, we would love to be able to, what we usually do is we let folks request up to a certain number of condoms. And so you can put in a pretty big request from the start and get your condoms and sort of see how it goes. In some schools, um, where their students feel really safe and supported to get condoms, they tend to go through them faster than other schools that maybe it isn't well publicized or students don't know about it. So a lot of it's really going to depend on you all and how you implement your program and how your students feel about it, along with a little bit about how your population works, right? Like the bigger schools obviously go through more condoms. The schools that serve 9 through 12 students go through more than the schools that serve 7 through 8 students. Some schools will go through 50 condoms a year. Other schools will go through 500. It's very dependent. And I would say it's okay with me if folks start off with a bigger number than they think they need. We do have limits on our Google form, like a max number that folks can order with that. And it's right on the form. I don't recall what it is at the top of my head, but we don't say you can only order from us once and then never again. So if folks put in an order and 6 months later are like, oh no, I'm out of condoms, put in another one. That's great. I think the first year you'll probably all figure out what it's going to look like for you. And for some folks, it may be faster, some it may be shorter. There's a question about, oh, sorry, did that get everywhere? Right. There is a question in the chat about are policy templates included in the folder or just the procedure? So we do not have a school board level policy sample in the folder. We had written one, I think it was 2015 or 2016. And then the school boards sort of said, we don't see ourselves ever using this because policies are really for K through 12. And we don't need a kindergarten level condom availability policy. I was like, yep, that is correct. You do not. So they're really procedure templates because they often don't need school board approval. If your school board would like to do a policy level approval, I would be happy to share some policy templates that I have with folks. We just took them out of the folder because they were confusing for people and school boards didn't want them. And they're not included in the Agency of Education guidance.
Kristen, you have your hand up. Would you like to speak?
Yeah, thank you so much. I'll take my hand down and just ask my question. Thank you, Andrea. That was amazing. So I'm thinking of here in Middlebury, like MUHS, the high school where I myself went, and this place, the designated space that you're talking about, and the bowl, and having it within a particular place that people remember and they can go back to. So is there like any sort of stipulation that it has to be within the school building? The reason to have condoms available at a football game, when I was in high school, or, I'm just thinking about, do these things have to be available within the school property per se, or is it possible to make them available at other kinds of events, like sporting events in particular? And does anyone else on this call do that? Like, do they just mostly distribute them from their office, or do they make them available in other spaces on school grounds?
Thanks for that question, Kristen. I think the law doesn't have a stipulation one way or the other. So if folks want to do things, want to leave it open for that sort of thing, absolutely. And you can put it in your procedure if you would like, but you don't have to. If our At Planned Parenthood of Northern New England, we have a high school student peer educator program where we train high school volunteers to really be the sexual health experts that their friends can go to. And many of them choose to carry a supply of condoms around in their backpack with them and just hand them out to their friends who need them. So there are lots of other ways that folks can do impromptu access points like that, whether they write it into their policy or not. So if you have a health fair, when it is safe to do those again, probably not this fall, like a tabling event or those kinds of things, those may be places where you'll want access points to be. And whether you want to enumerate those in your policy or procedure that you write, or whether you want to say things like at specific events, or whether you just want to say, like, if a group says, can we hand condoms out at the football game, and you want to say, yes, here you go, that's totally, I think, up to each individual school about what will work for their community and their student body. And I think that's another great example, right? Of like, we think that this is new, but it's actually been going on for a lot longer in some cases, right? Like, I was in high school in the 90s, and like, we did this sort of thing all the time. And it was just very funny to me to be like, a lot of people are like, oh yeah, of course schools hand out condoms. What do you mean they don't? When I was having these initial conversations back in 2013, and I was like, you and I are probably about the same age, and we remember that condom champion person just doing the thing. And then they left the school or retired, or we left the school and it stopped. So there are lots of ways to be creative about that and ensure that folks in your community and your school have access. Any other questions that folks wanted to ask at this point? You're close to wrapping up. Let me just give you my last little piece, sharing my screen again. And I just want to say that COVID has made us practice some skills that can also be really relevant when we're talking to young people about navigating sexual interactions. Maybe you all have noticed that people are more commonly practicing consent when asking for a hug these days, right? Are you okay with a hug if we're both masked? Like, does that feel okay for you? That's negotiating consent. When we're talking about negotiating COVID boundaries, people usually talk about who they've been around. Have they been tested recently? What are their risk factors for having contracted COVID? And what do they feel comfortable in light of those risk factors? When people have an unknown COVID status, they might choose a risk mitigation strategy like wearing masks and being outside when they get together. If we want people to use masks or get tested or use hand sanitizer, we have to make them easily accessible and readily available. And I hope these things are sounding very familiar and applicable to helping young people negotiate safer sex as well. One very last time, that is my personal email, but also my direct email is andrea.nicoletta@ppnne.org. It is hard to spell though, so education@ppnne.org will also get to me. And there is that condom availability folder with all of the resources that I've mentioned. And you can feel free to reach out to me directly, check that folder, and we can do what we can to help support you in implementing this law. And also, thank you again for all of your work every day in schools, and now every day in schools for sure. So you are much appreciated.
Well, thank you so much, Andrea, for coming and speaking on this topic. We appreciate experts like yourself coming in and sharing information that affects us directly. So thank you so much for your time. We will be sending out information about next week. We may be having a town hall next week. We're not quite sure yet, but we may. So just watch for your email next week, and hope you guys have a great weekend. And we will all be putting condoms in our school soon. And thank you, Andrea.